if we start to do a traction in maximal loose back position, for example, the glenohumeral joint, 60 out, 60 forward, slight external rotation. In this position, the capsule parts are equally stretched. So if you pull and apply a traction technique, all the capsule parts are stretched equally in normal, healthy situations. Now we have a patient with limited or painful external rotation. So which capsule parts might provoke this limitation? Anterior part. 60 out, 60 forward, slight external rotation, and then you apply a traction technique. Which capsule part will provoke? All the capsule parts or the ventral part? I have a limitation. Anterior capsule is short. Theoretical maximal loose back, 60 out, 60 forward, slight external rotation. Are all the capsule parts equally stretched? No, because the anterior part is affected. So I pull lateral, cranial, a little bit anterior, that's the traction direction. Which capsule part will provoke? The anterior part, the affected capsule part. So applying the traction technique and asking the patient, do you feel any stretch or pain? If yes, point me where. I hope that I can provoke the same pain as in angular external rotation. Yes. Additional assessment, positive. Now I know more. It is the capsule. Why not the pectoralis major? Why not other structures? Because I don't angulate. And the pectoralis major is far away from the joint, so a slight movement is much more specific for the anterior capsule. Yeah? Clear so far? So even a not so specific technique as traction in maximal loose back can already give you an answer on your question, is the external rotation limited by the anterior capsule? If it's only a small problem, a little limitation, not that painful, I have to provoke more. How to provoke more? Give more stretch on the anterior capsule. How to do that? I can apply a traction, but not in maximal loose back. I'm going to stretch the anterior capsule more. Ouch, it hurts a little bit back. Now there is pre-stretch on the anterior capsule part. And now apply traction. Which part will protest? The anterior part. Yes. Test positive. So by leaving maximal loose back, you change the amount of stretch on every part of the capsule. You can pre-stretch some parts and you can loosen up other parts. You don't want to provoke the anterior capsule. Go opposite and apply traction, then it won't hurt. That's what we do in pain relief techniques. But now in assessment to provoke whether the limitation is limited by capsule, then you try to provoke more and more and more. But traction is still a general technique. It gives pull, stretch on every capsule part. Some capsule parts more if you leave maximal loose back, or equally divided if you stay in maximal loose back. And even then, in patient situations, it gives us enough answers. So far, traction. How can I stretch even more the anterior capsule? I can use a slight movement anteriorly in maximal loose back. What happens with the anterior part of the capsule? Stretched. What happens with other parts, mainly the posterior part? Less stretched. The pull, the push is slight anterior capsule is provoked, and there is not much stretch anymore because you take away this stretch. Yeah? So slight anterior in maximal loose back is more specific for the anterior capsule. It's a more specific technique. So if you slide anterior, it's called a direct technique. If you go in another direction, it's an indirect technique. a direct slide, the maximum loose back provokes the anterior capsule more if you slide anterior. If you leave maximum loose back and you go to a position where the anterior capsule is pre-stretched, and then a little back again if it's painful, and then slide anterior, wow, even a small problem shows itself, because there is already a lot of pre-stretch. Yeah? So an anterior slide in a horizontal abducted position, specific to stretch the anterior capsule, is even more provocative. Well, then the last way to provoke, if you slide in this pre-stretched position, anterior, and then at the same time pull the elbow backwards, it's even more stress.